Good morning, everyone. Welcome to the webinar. We're so excited to have our friend and colleague, Chris Jaquis. Don't let the name fool you. I don't know what occurred here with GoToMeeting, but this person on the right, this handsome double, that's Chris Jaquis of Antidote. And I'm, of course, in the middle, Jeff Beglin. And on the far left is Brad Petrella. So
the real Brad Petrella.
The real Brad Petrella. Chris, can you say hello? Just real quick.
Good morning, everyone. I'm looking forward to speaking with you this morning.
Fantastic. Okay, so we're off and running, and then I'm going to go through my slides real quick, and Brad also will be jumping in as well, but you know the drill. If you got a question, you put it in the question box. I know we'll have a lot of questions today, and then we'll get to those. You know, we're going to jump in throughout. So, and then we'll get to certainly a lot of questions at the end of the presentation. I'm going to toss things to Brad. Brad, talk about Cornerstone, if you could.
Hey, everybody. Again, good morning from me. A lot of the names I see on here, we are already acquainted. That's our contact information. I'm the newest addition to the team. I started in April, and I'm pretty much covering the eastern half of the state. I was going to say the country. That's a lot. Chris does that. So yeah, and then Jeff has been with us, I think, going on 18 years.
It'll be 18 this winter. Yeah.
This winter. There you go. And so a lot of people know him over the years because he was the only one they could talk to. And then of course there's Eric Pouncey. He is our broker specialist. He's really responsible for Health Sherpa. He helps us on a lot of the technical things, and he knows the products, and he knows the plan. So he's another resource. Maybe when Jeff and I are on the road, he usually works out of the office or sometimes hybrid from home. So that's the three of us, the three amigos.
Okay. Is the third amigo on the call?
Eric,
yes, I'm here.
Eric,
there you go. Fire away.
Just teed you up for Health Sherpa.
Yeah, so we got Health Sherpa. It's our ACA enrollment platform that we use. It's cost-free for you. We have a link that gets you started to get a sign-up link that I typically send out to everybody. Zero cost, again, to participate. Your drug and provider searches are on there, and you have real-time status updates on your clients, and it does a good job of reporting and pulling out analytics as well.
And making renewals easy in the next year, correct? Yeah, and actually Health Sherpa will be on the Health Sherpa platform. What did I say? I said Antidote will be on the Health Sherpa
Antidote,
platform.
yeah.
Yeah. And as I recall, Eric, correct me if I'm wrong, the renewals will start appearing here maybe in a week or two out there, right?
They should be coming up soon on there. You'll see it next to, like, on the client-facing part of Health Sherpa. If you go over to the right side, it will have a renew button, and that's where you'll click on that, and it'll show you the new rates for the upcoming year.
And Brad?
All right. So since if you like the service that the three amigos provide to you, and you want us to wanted to refer us to other agents that you encounter who might be griping about their current upline where they're not getting very good service, we're very good at service, and there's a whole team behind the three of us, as a matter of fact, that can do that. So if you refer somebody to us, once they put a policy on the books, we will pay you a $250 bonus. So, and little extra money for you as a thank you gift for referring us an agent. Perfect.
Fantastic. Okay. And remember, this is Chris Jaquis on that side of the screen. Okay, not Brad Petrella. Chris Jaquis. Spell your name for us, Chris.
It's Jaquis, last name Jaquis.
Okay.
So real simple. Those of you from, I guess up there in northern Ohio, Cleveland, New York area, there might be some Jaquises running around the Buffalo market. So you might have seen that name before, slipped down into the Cleveland area. And I understand there's a whole branch of my family out there with an H on the end. I don't know them. I don't know the Jaquises, but I know the Jaquises.
That would be Jaquis.
Okay.
Yeah.
Interesting.
I'm going to make you the presenter.
All right.
Okay.
I can steal now. Here we go.
Yep.
Yeah. Chris Jaquis.
Everyone, let me know what you're seeing. Hopefully we'll see in the presentation in just a second. Are you seeing the presentation?
No, just your home screen, but there it is.
Terrific. Are you seeing the presentation or are you seeing my slide, the presenter slide?
Presentation.
Wonderful. Well, good morning, everybody. Thank you for joining this morning. I'm sure you'll have lots of questions. I'm guessing they'll come from you, Jeff, Brad, and Eric. You'll read them?
Yep.
We have a quick agenda. Obviously, won't waste your time here, but we're going to run through a few key points throughout the morning. We are a new entrant into the health plan, into the ACA, excuse me. And before I get too far into it, one of the things I'd like to ask is, of course, no responses, but I'm sure many of you have already gone online and looked up Antidote, and what you're going to find today is a website for a telehealth company. And we're going to talk about why that is and what that is in just a second. But that is us, and that will be changing very soon. We are a larger organization that has a telehealth physician organization, as one of our key elements of our organization that was created 4 years ago, in the plans to actually become a health plan, and to be a virtual health plan, which we're going to talk about in just a second. One of the things we believe that quality healthcare is a basic human right, and we strive to attain that within the world, and every human should have affordable access to care. I think that's the point of the ACA. We feel that it's our motto, so we're really excited to be here. We think we're going to revolutionize healthcare. We've got a virtual first approach. You'll hear me say this over and over throughout the presentation, but when in doubt, go to the app, go to virtual, reach to your virtual doctor. Virtual physicians will help reduce copays and medication costs. So that's a key theme throughout all of our plans, and you'll see that as we go through. Just to tell you a little bit about our telehealth organization, we have been around a while. We wanted to share with you our NPS score, 78. I think is, in the upper percentile. We've been very blessed to have great referrals and recommendations from our users. I think one of the questions that was been asked over and over again is, why is Jaquis one of our ambassadors? Well, if you haven't read his story or heard his story, it's a great YouTube video. We're blessed to have him as one of our investors and ambassadors. And that leads me to 2 points. I know that a lot of people asked the other day, being a startup health plan, how do we know you're going to be around? How do we know you're going to exist? How do we know that you have the backing to be able to be a health plan? We have multiple investors, including Jaquis and his investment group, and they have signed on. They understand that this is not a short road, and we do have seen that we are PCA, or private investment bank, backed.
And for those that don't know, Jaquis is actually a pro basketball player for the Milwaukee Bucks.
Correct. Thank you, Brad. Yep. One of the things you'll also note, if you're on our website, and I touched on it briefly, you won't see anything here. We are waiting our final approval from CMS. That should come this week or early next. We're very excited, but until we have that, we have a very conservative council, and we are holding back on that because we don't want to make CMS angry with us prior to our true launch on November 1st. So that will be up and running. There'll be some live links throughout the presentation that will be shared with you, that you'll be able to click on and check out some services, and we'll go through that. But we are excited to be entering the Ohio and Arizona markets, and let me show you where they are. So here in the Ohio market, I think it's pretty obvious, and we're very excited to be in that Cleveland market, Cayuga, Medina, Summit, Lake, and then you'll see here we're down in that Columbus market in the I-70 corridor. And we do have Hamilton and Butler. So obviously, as a new entrant into the market, we chose the population centers, but we also were very blessed to be partnering with a group called Quality Care Partners, and they're out of Zanesville, Ohio. And that is how we developed and built our network in partnership with Quality Care Partners. And I think there are some significant call outs to our network in the Cleveland market. Obviously, Cleveland Clinic is a partner, and we're excited to be able to work with Cleveland Clinic through the QCP relationship. And then when you look at the center of the state, you'll see Genesis, Ohio State. We're really excited there. And then the Mount Carmel Health System. I think our network speaks for itself. We have some work and we continue to work. We're actually presently negotiating with Cincinnati Children's in the Hamilton Butler market, but we are building there as well. That is, we do have vision and dental care. Paramount is our dental provider. VSP is our vision provider carrier, and then we do have PBM RX Advance, which is powered by Optum, as our pharmacy benefit management team. We're also in Arizona for those of you who are duly licensed. I won't spend a lot of time on this today. Obviously, we're focusing on Ohio, but again, we are partnering with private healthcare systems, PHCS, in Ohio. Quality Care Partners is actually our clinical partner there as well. And you can see that we've built a solid network in Arizona, in Maricopa and Pinal counties, including Banner, Common Spirits, and Phoenix Children. I'm going to move forward. Like I said, not spend a lot of time in Ohio this morning, but any of those of you who are duly licensed, if you have any questions, Brad, Jeff, Eric have my contact information. Please feel free to reach out. So what's the benefit of us? We believe we're accessible, we believe we're affordable, and our goal is to be convenient. So how do we talk about that? Accessible. We build our products to serve the lifestyle of our members. We believe, especially through COVID, there's been a significant shift, people being willing to accept virtual visits first. And we have a fleet of doctors that are online and available. We are recruiting more doctors also, specifically in the Ohio market. So that's another thing to note. But we think access should be simple. We don't think waiting 3 to 4 days to get a doctor visit is acceptable. Affordable. One of the things you're going to see is we really have eliminated what we consider to be the nickel and diming of regular healthcare. I am not going to lie to you and tell you that we don't have co-pays, deductibles. They are still there. They are, especially for hospitalization, things of that nature. But that everyday cost of care, we've tried to eliminate by using the proprietary AI and the decision-making tools of our telehealth division, so that we can reduce co-pays for visits and for medications. And we'll talk more about that as we move through. The convenience, we think it's really easy. We have this handy dandy app. It's on your phone, it's on your computer. You can request a doctor visit. Most visits happen within 60 minutes. We actually guarantee within 4 hours, but actually most visits happen within 60 minutes. We're actually averaging like 44 minutes per visit, which is wonderful. But we do guarantee 4 hours right now. And we hope to continue that and keep that at that pace. We think it's very, if you think about families, which we'll talk about next, the crying baby, fever at night, what's going on? Going to the ER isn't acceptable. We think, being able to pick up the phone, use your app, talk to your doctor, not leave the house in the freezing cold in the middle of the night to go to an ER to sit there for hours with your screaming baby. Maybe it's better to get a doctor right on the phone, and maybe we can diagnose this right away. Telehealth isn't the answer for everything, but we do believe that virtual first can save and help members have a more convenient and more accessible experience. We do have some offers for our families that you'll see and we'll talk about with $0 first pre and postnatal visits, and we'll get into those a little bit. We do have our MVP rewards program, which we'll talk about more, and we hope to expand as we are around longer. Right now, it's very early on startup, but with everybody who signs up and goes through and does their health risk assessment, which is an ACA compliance requirement, you'll see we have a $10 gift card. We have some other things we're going to be offering, reduced co-pays, things of that nature throughout the year. But this is a start for us, and we're very excited. So about the plans. So this is Brad's least favorite slide coming up next, but we still have it in here. I haven't really reworked it, but these are the kind of the quick overview. We'll call them tabs, so you can kind of read what we're offering in these plans. Very confusing just to read it and not see it, but I just want to show them to you. An example, the Antidote Silver or Gold program, cash back, unlimited virtual visits, PCP specialist mental care, $0 select and top RX. Again, individual and family plans. And this gets a little bit easier to look at and explain. And I will walk through this, and I apologize, it's on a bigger screen to my right than directly in front of me. So how this works, and I just need to, are you guys probably seeing your, there we go. Is that better for you all? Show you this here, how this works. So our 24/7 plans and our 24/7 complete plans. You'll see here, bronze, silver, and gold. And you'll see what it is called antidote visit, antidote referred visit, and another visit. So what do I mean by that? So an antidote visit is a virtual doctor visit with an antidote physician. So just for clarity, at this point, we're not able to include if Cleveland Clinic or your primary care physician's office offers you a telehealth visit directly through them. That's covered in part of the plan. But that is not what I'm referring to when I talk about the antidote visit. The antidote visit is with the Antidote Healthcare physician team, and that is what that means. And as you'll notice, they're free, always free, all free, free. So we're very excited about that, to offer that to our members. So free telehealth visits, primary care visits, and some specialist visits. Antidote referred visit. So if you're on that antidote virtual visit and the doctor refers you to go to your primary care physician, to go to a specialist, to go to a mental health visit, you can see how that visit is got a different copay level, and that's right here. And that kind of runs down through. And you'll see here 2020, and as you know, the different plan selections, the different copay and premium selections. And then you have the other visit. So this would be if you chose just to go to your doctor without calling the antidote physician first or doing the virtual visit first, you'll see what the copay levels are. I'm hoping that makes sense to everybody. I'm sure there's some questions, and this is where questions usually come out in the live sessions. So Brad or Jeff, please feel free to interrupt if you have questions. You'll see here, folks, I won't click on this right now, but these are live links to these plans. So the 24/7 bronze plan, if I click that link, will take me right to that, and I will show that link to you in a little bit. We'll come back and do that, but I don't want to lose track here. As we move down, the family first, same coverage, gold, silver, bronze. I'm sorry, bronze, silver, gold. The antidote visit, ARVs, OV visit. Then you have added things into it. $0 family with family first plans, copays, $0 child and adolescent behavioral health, things of that nature. Your first and post prenatal visits, $0. They're all self-explanatory. I think this chart speaks for itself. I am showing Arizona. I apologize. It doesn't change. If I go to Ohio, it's the same chart.
I was going to ask. Hey, Chris, great question before you get there.
Yep.
Jeff Lang asked a great question. Are these virtual visits with local doctors, say at the Cleveland Clinic, or are they located elsewhere? And so talk about the elsewhere first. Where are all of the Antidote virtual doctors located?
So first and foremost, the doctors are all licensed in Ohio. So a doctor cannot provide services unless they're licensed within the state. We have physicians licensed in Ohio. We are recruiting more physicians in Ohio. We have a couple in Ohio right now, presently living in Ohio. They would not be specifically at Cleveland Clinic at this point, or not per se. We do have physicians around the country, as well as we have physicians based out of the country who are licensed in the state, and they kind of cover off hours for us. So does that answer your question, Jeff? But they are all licensed and have to be licensed in Ohio.
Yeah, so all of the doctors really, just in one word, are all onshore, except for sort of overnight. They have overnight doctors, I think, located in Israel, because there is an ownership of Antidote, in a partial ownership from folks in Israel. And I think, Jeff, your question was about, Chris just said, yes, you can see a Cleveland Clinic virtual doctor, but if it's not referred, it's going to be that higher copay under the column listed OV, right? Because you're going direct.
Correct. So just remember that the Antidote virtual doctor is the Antidote Health Group physicians, not another physician group. That's the easiest way to think about it. So if you go to use the app or go to the Antidote virtual doctor, that's when you enact the reduced copays and reduce medication costs.
Let me just ask one more question before you jump further. Denise is asking, how do they cover preventive care? Does it have to be with an Antidote doc, or can it be with a member's PCP?
So first off and foremost, we will say that all preventive care, most preventive care is free of cost in the ACA. Secondly, all of it is covered, but you can those items that would have cost could be reduced if you use the Antidote virtual doctor first.
To basically schedule that appointment, right, guys?
Yep.
So here, Chris said this in person. When in a pickle and you don't know, call the virtual number first. That's really the simple thing. If you start there, you're always going to get a reduced cost for any service. So that's really a simple way to put it.
That's the way to put it. When in doubt, go to the virtual doctor. I always show my thumb because I think about pushing the button on the app, because there isn't an easy to use cell phone app, iPhone app. It's really easy to use. So we think that's the best and the way to remember. Again, I want to emphasize these are live links embedded in this document, and we will share this with you. I think Jeff and Brad, you have the full presentation we're going to go through today, as well as the abbreviated version, which are some of the key slides that have this information. And those are the SBCs, if you click on those. So you're going to see down here in the bottom of the screen the different pill bottles or pill capsules. This kind of shows you the plan and the level of the pharmacy coverage. And this is kind of just a quick overview for folks. And you'll see the plans that add dental are down here as well. So if you want the 24/7 bronze family first dental plan with dental, it's down here on the bottom. So family first. If you just want 24/7 bronze with dental, it's the one above it. So on this slide, you'll see that we're representing 1, 2, 3, 4 times 1, 2, 3, 4, 5, 6, 24 plans. That's a lot of plans. It's already too many at 24. And you're going to say, which one are we recommending? I'm recommending off this page, and honestly, we believe that the family first and the plans above it here, you see these 12 plans right here are our best options and richest plans for your members. You'll see when you get online and get to the marketplace, in our design build, in our initial offering, we made a mistake, misread some things and CMS's rules, and we have 140 plans. I do not expect you to know and understand 140 plans. I'm asking you to look at these 12, and that's kind of where I ask you to focus. If you want the dental, obviously they're down here to add the dental cost.
And gang, by the way, I've got this presentation. So for all of those of you on the line, after the presentation's over, we will send this to you because it's a great sheet to simply have for your reference. It's got about 4 slides included in that deck.
And Chris, if I could jump in here, I think you made a point telling me that you know, the 24/7 complete, the real advantage there is the drug, among other things. That's one of the key features there.
Yep, the pharmacy benefit is huge, and we'll talk about that when we get to the pharmacy list, which is actually Nest's formulary. But we believe, and we cannot see the 2024 rates yet. I think there's some insight to them. You may actually have them already from your other carriers, but we don't have that open access that we'll have after November 1st to see everyone's rates and all that kind of information. But we believe, based on our actuarial work, that our 24/7 complete bronze plan in most of the markets in Ohio, which there are several, which we'll talk about, the way they do pricing with the ACA, we feel our 24/7 complete bronze will be less expensive than most other silver plans, and we believe is as rich, if not richer, than most other silver plans. So we think that's a really competitively priced plan for an individual, the 24/7 complete bronze. But hopefully we'll find that when the market gets released. I think there's some insight now to where rates are, but I don't have that finalized yet. As you know, it's a flurry of information in the last 2 weeks before open enrollment. I'm going to jump forward. This is our pharmacy list. So what do we mean? So you have their top RX and your select RX. So when you can do the comparative pill bottles, this is clearly select and this is top. And so what do we see here? These are the plan numbers. They'll match up to that sheet that you had. These are not live links here. I apologize. But $0 copays. And I'm just going to leave this here for a second, and I'll give out 10 seconds of silence and let you read the list. I think we've got a pretty good $0 extended medication list. And I do believe that members can benefit, especially if you think about those who take diabetes medication. If they join our diabetes clinic or our high blood pressure clinic online, they can get $0 medications as well as lancets, needles, and syringes. So I know I have several friends who that has been their ongoing complaint in healthcare. They don't go to the hospital a lot. They're not, they don't, knock on wood, none of them have had that major incident or accident, which, again, we talked about copays and deductibles will always be there. But they do tell me that they spend a lot of money on their medication and they spend a lot of money going to the doctor. We think that's ridiculous. $0 medications with the virtual visit and going to the clinics. Why would we not support that? We believe that's what people shouldn't be struggling to pay their medication bills. And so you'll see this list. And we think this is a pretty good list.
And again, this is only their, that 0 extended drug list. Some of the other carriers may say it's like tier 6. So these are just the drugs at 0. The formulary goes well beyond just this.
And for all of our plans, all of our carriers are in all of our plans. I'm sorry, let me say that. All of our providers are in all of our plans. All of our medications are in all of our plans. You might have a different benefit level based on plan selection, but we do not at this point have, I took a gold and my Humira is covered, I took a bronze and it's not. We didn't do that. There's coverage for everything. It may change based on plan level. Same with providers. We have no providers that are in the gold and not in the silver. We just don't, we didn't like that model. So I included this very big, very large look at. You'll see this is Butler and Hamilton. We have Delaware Field, we have Cayuga. Did I say it right that time, Jeff?
Cuyahoga, it goes both ways.
Lake and Lorain counties and the G. We're excited to be partnering with you guys, and I will learn the names. I live in Pennsylvania. I thought I had a good handle of them. I've been corrected a bunch. And we'll do some comparisons for you in just a second. Matter of fact, see if I can, I'll wait till we're done the slideshow so I don't mess it up. I'm not a technical wizard, and show you some rates and where they fall, just to give you an idea. But these are our premiums. We don't have adolescents or children on here, but these are our rates and where they fall. This is on and off exchange rates are included in here. So, and you'll get these also in a smaller packet. Like Jeff said, Brad said, we're gonna forward you an email with like 5 or 6 key slides, including these rate sheets. So you'll have them at your fingertips if you want them.
Great. And Chris, while you're on this, actually, Jeff Lang asked another great question. There is an HSA available plan, right?
We do not have an HSA available plan. That was an extra layer of application for us. And in our first year, we did not fill that application out and file for that. Probably next year, following year, as we expand and grow, we'll be looking to do that. And we'll talk a little bit about that. Matter of fact, this is probably a great segue. Thank you, Jeff. We're a startup health insurance company. And I'm going to talk about customer support and service and setting. But one of the things I want you to know right off the bat is we expect there's going to be some problems. We expect there's going to be some confusion. There's some operational issues. Why do we expect that? Because I've been working in health insurance for 20 plus years. My boss, her boss, we've all been in the field. We're old. We know how it works. There's problems when you're an everyday, long-standing, a Blue or a Centene or any of those problems. We're looking to limit the plan this year to roughly somewhere in that 3,000 member range, so that we can provide customer support and service and get things resolved and be available for members. And we'll talk about that. But I just wanted that was a great segue, Jeff. And with that being so small, we didn't feel we had the capacity to complete that application and provide it the service it would need based on our level of experience to do that HSA compliant plan. Maybe more than maybe we overread it too. That could be a thing. So let's talk about. We're not changing slides. Here we go. Our process. And here it is, we're going to just hit back on that fact we talked about earlier. You have a chronic condition, such as a diabetes or hypertension. Go to the website. You'll have already logged in, you already have a profile. You'll have a dedicated provider on there to get care with. So you can actually select your virtual provider. And if you like your virtual provider at Antidote, you can request to see that provider. Now, I will tell you, like every physician, they're not available 24/7 for you only. But if you want to schedule to see Dr. Brad and Brad's not available, you can schedule to see your virtual physician and only see that physician on the app. Very much allowed. Or you can just see most first available. So you can see that. But then you'll see we'll get a benefit, the medications, and eligible referrals, and we'll schedule you for a $0 copay follow-up with a specialist. So you'll see how that works. It's real simple. When in doubt, go to the app. Over here on the right, and you're not feeling well, just need everyday care, call the doctor. Get a scheduled visit. Get the care you need, get care faster. Now, I spoke to this earlier. We do know that there is a need for urgent care, there's a need for emergency care, and there are things you cannot do in a virtual visit. You can't draw blood. But let's talk about the cost of care and what goes through a member's mind. I actually had a personal visit yesterday. I had to go to the doctor. What did they do? I sat down, they drew blood. I could have done a virtual visit, would have saved me an office copay, and I could have gone over to Quest Labs and had my blood drawn and had my reduced copay if I lived in the Ohio market, but I don't, so I don't have Antidote. I had to go to a doctor, pay my copay, get my blood drawn in the office, pay for an office visit, and play that extra code for that medication, that blood draw. So we think we can help people with costs. Mental health, growing need. I think we all know that. Actually, that is where I have managed and worked in care for a long time. Go online. We actually have a bot that is actually designed for adolescents with anxiety and depression, which is a wonderful tool. But you can get first free session with a dedicated provider. You can request the same provider. You can have an assessment. You can get referral. And the referral doesn't have to be virtual. That can be to bricks and mortar in your community, your specialist of your desire, if you want. So again, go to the app, log in, get that first virtual visit, and then get referred, get a reduced copay. Just stressing some of the points we talked about earlier. You'll see them here. This is more hopefully for you to talk to your members about. I'm going to actually talk about the disclaimer. This is one thing I think that some plans in the ACA have not done. First off, if you are traveling throughout the United States, you have access to your health plan through virtual care. And that I will say that is limited to 22 states or districts, but you can see your virtual doctor. So if you're traveling to Florida, you get sick while you're at Disney on vacation, you don't have to go to the ER. You can go to your virtual doctor. If you do need to go to the ER, that is covered, of course, because you're on an ACA compliant health plan or urgent care. If you go to your virtual doctor first and get referred to urgent care, you'll get a reduced copay. So again, and that's all based on plan level. But I think it's important to know, as well as if you're out of what we call the service area. So if you remember, we showed those red blocks on the map to the Cleveland market. So you're traveling off the Bowling Green. You end up having to go to the doctor. I don't know. I'm trying to think who's there. I think there's a Mercy there. At Wood County Memorial is there. I know that hospital.
No, it's like Fisher Titus, Bellevue Hospital, and
right. If they're in network, that care is covered. So the example we had, and I think people were asking over and over again, I think we have a lot of families with college kids from the Cleveland market who go down to Ohio State or go to one of the Ohio State University system. So Toledo, Ohio, etc. They need care. If our network is available in that market, they can go there for that care. That's acceptable. That's Antidote Health Plan, bricks and mortar, as well as, of course, always use virtual care. And we'll help you find that doctor in your market as well. So that's just a key thing to remember.
Chris, there's a great question before we move on that's kind of related. And so Michelle is asking, are the copays that we see, and that's probably back on the copay slide, which is really helpful. Is that pre-deductible or is it included or excluded from the deductible, the copays that you see or that
included
you
in your max, included in your max out of pocket? That's part of an ACA plan criteria. And we're going to go to an SBC and review that in detail when we get through the whole presentation. So we'll come back to that, but it's a great question. Thank you. Antidote value for brokers. I don't know if we can provide you a whole lot that other folks are, but we're going to try. And one of those is we're going to try and eliminate administrative hassles. We have a team dedicated. They're going to be available. They're basically available 8 to midnight every day. Actually, we do have 24/7 support available, but the dedicated team is going to be 8 to 12. But our customer service help desk, all lines route to one point after a certain hour. And so you would have 24-hour support if you needed it. We do have a portal that's getting ready to get rolled out. We're working on it with our TPA, and that should be out very soon. You should be receiving a link to that as you get appointed. We think brokers like digital, like easy, push a button, get an answer. We're trying to get more and more, get there for you guys. And we want to keep you updated. That is our plan.
Before you go to the commission, can I bring up a question about the test, a little appointment quiz test, and maybe the little hack after that?
So for appointment, is that what your question is, Jeff? And I'm going to cover that separately at the end.
Oh, okay, so, fantastic. Okay.
Yeah, I'm going to cover. I've gotten better, Jeff. You saw the very first presentation. I've gotten better.
Okay. Okay.
I will come back. I'll show. I actually have a slide. I have a whole little side slide on that.
Okay, great, fantastic. Glad.
So commissions, we're paying $20 on or off exchange per member, up to 5 members in a family per policy. So if you have that family with 6 or 7 members, thanks for selecting Antidote, but we're going to pay for the first 5. And we think that's, I think, hopefully we're competitive. We're trying to be competitive in the market for you guys. Important links. These are all live links, so you will get this slide deck today. These are all live. So you can go in there, you can look up providers, you can look up the vision plan, you can see the SBCs. We're actually going to click on that right now. This is our customer service deck. So the broker desk is open 8 to 12. Our customer support desk is 24/7, if that makes sense. So members can always call, and you can call also. We're not saying, we're not going to hang up on you at 1 a.m. if you're calling. I just don't expect you'll be calling me at 1 a.m. But let me just go to an SBC. I'll bring that up. So here you'll see all of our plans. Brad or Jeff, you got a favorite you want to look at? You've got one that catches your eye?
Let's look at that bronze that you talked about earlier.
There you go.
It might be among the lowest in Ohio.
Yeah, so let's go. It's the bronze 24/7.
Complete.
24/7 complete. And a bronze 20. Yeah. This has dental included. Here it is. Without dental. So we'll do it without dental. So these are all live links. If you guys click on them, they will come up. As I say that, I'm like spinning wheels. Not there yet. Let's try it again.
Chris, it may be, you might have to unshare your screen because it may be doing a pop-up. I don't quite know.
Yeah, try a different browser perhaps. If you can't, generally you can't use the same browser they're using for.
It's still spinning.
Yes. Yeah, so unshare real quick, get to that.
Am I still sharing?
Reshare. No. So while you're not sharing anything, go ahead and open up that you wanted and then reshare that screen and it will appear.
Okay, I've stopped spinning. I think I've lost connection. Here we go. Here it comes.
That's what happens when you live out in the country in Lancaster, Pennsylvania.
There we go. So now, am I sharing now?
I'm not seeing anything yet. Jeff, are you?
No, unfortunately not.
It's here. It says I can make you the presenter. I think you have to let me back in, Jeff, or maybe it's this button. Now you can
There
see
you
it?
go.
All right.
Yeah.
So here we are on the
Yep.
24/7. Thank you for the little technical tip. Appreciate it. Oop, what happened? Minimize this. There we go. So here you'll see the deductible. You see the preventative care coverage. So here, premium balance billing, what's covered, copay office visit, covered $0 copay office visit when referred by an Antidote virtual provider. So again, use the virtual provider. You'll see the $100 copay. There are some limits. I'm not going to lie about that. There are some limits, obviously, with everything. There's this fine print.
Jeff, stay there for a quick sec. Go back up to PCP specialist. If you look on the bottom of that line, Michelle, this answers your question. Deductible does not apply. So for PCP specialist and preventive care, deductible does not apply. So you are just paying that copay.
Oh, my apologies. Thank you. Good catch.
Yeah. I thought that's what you said together a couple of weeks ago. So didn't want to mess up your flow.
Thank you. We'll see here, the deductible does not apply. And we move down, your co-insurances, requires authorization. And they give you an example here, the examples of care. And here in the bottom, they always give us an example. And these are included on every plan, so you can see them. I think this is a pretty good, we did spend a lot of time on these, and we worked closely with Milliman, who helped us provide these. So I do have one quick example I wanted to show you. And thank you, Brad and Jeff, for your help, because I don't have access to the subsidy calculator at the moment. But are you guys still seeing, are you seeing my spreadsheet now?
Yep.
Yep. So a 48-year-old female with a $45,000 annual income, I can make this bigger too if it helps for everybody. Her premium would be, based on the chart that I showed you, is $610. Her subsidy per month would be $234, so her monthly premium is $376. And these are just so you guys can see, I put the formula in there, so you can see how that worked out. And I just went across here.
So everybody knows, I took 2023 subsidies and applied them to Chris's 2024 plans, just to give you an idea where this stacks up. When you see those high numbers there, that was all on a previous slide. That was all pre-subsidy.
Correct. There are no subsidies are included on those larger slides. You'll see here the 48-year-old and 50-year-old male, so the married couple making $65,000, living together, goal 24/7. Premium is actually going to be $2,024.32. The subsidy $620. They're paying $1,400 a month, and this was their individual cost. This was my doing the work out here, so I got them. I will say in the next one, the family, I estimated the cost. And you'll notice on those slides, we don't have male and female. Obviously, those charts would have gotten very cumbersome if we did it. So everything is kind of joined. So they're not 100% exact, but they're really close. But $85,000 family. Oh, I forgot to do one. I need to go back and do that for you, Brad. I apologize. We see 2484. They get $1,100. They're looking at $1,300 a month for the family. So we think we're going to be competitive in the market. We really do. And I do think we target, the 25, the 55, 25 to 65-year-old youth member, predominantly in good health, I think can benefit from our plans. I do want to take a quick second now and jump over to, I have another slide deck to show you. For those of you who are interested in becoming brokers with us, I will actually do a slideshow for you. Hopefully it will pop right up. Are you seeing the slideshow?
Yes,
Yes.
sir. Yes.
Yes. Okay. So we chose to use Miramar Agent as our tool for onboarding and appointment process. So our appointment process is, we're hoping it's 10 to 20 minutes max. I'm hearing it might be 25 to 30, and I apologize. And it seems to be some technical issues, which we'll talk about. But we use Miramar Convey, and once the agents have received the link to Miramar platform and a PIN, which they'll get from Cornerstone, Brad and Jeff, I believe, are your initial contacts, and they have someone in the office who will be sending that out. You'll basically run through the app. There's a few things to call out, and we'll talk about that in just a second. But there's a welcome form. There's an agent agreement that the agents, agree to, a code of conduct. We do a background check. We are reviewing anybody with anything that pops up there. We're asking for an individual review just to look at that. Certain things happened years ago. We're not excluding people because they pop up on background check. We need to review what it was, so then we can make that decision. There is an antidote test. Being as our first year in existence, we thought it was important. We were directed by compliance, CMS, that we needed to have a test. So we did that, and we all do request a copy of your license. The test is easy. For those of you paying attention at home, there's one answer that seems to be consistent. If you do the virtual visit, there's reduced $0 and reduced dollar copays available. Logging into Miramar Agent. If you've been on it and have used it in the past, you will log in like you always have, and you will be submit your password, you'll log in, and you'll go to your dashboard. If you've never logged in before, you will select register as an agent. I will let you know that if somebody in your office is registering or appointing multiple agents, every time they do it, they have to go through the test. And I highly suggest you clear your cookies and your toolbar, because it will keep coming back to previous responses. So that's a big thing that's happening. We've learned that. If you are already logged in as an agent, you have used Miramar, you'll be asked for a code after you click register for a new program, which will drop you into one of these, and then you will go through and complete that.
Just want to jump in here real quick. Somebody was having an issue with one of the browsers for Miramar. Was it Chrome?
Well, we're understanding that Safari and Chrome on an Apple, which might be working through Safari, might be causing issue. I've heard people with Safari and Chrome not have any issue. I've heard some that have. I use Chrome. It works for me on Chrome. Microsoft Edge seems to work. I think the most important thing is, if you're doing multiple agents or you have an existing account, clear your cache, clear your cookies, and start over. And I think that's the most important piece of information. But there is also a note. This is an external website. You can call us. We will walk you through the best we can. But you'll see right here, there's a knowledge base. That is their help desk, as well as help at Miramar. And they will provide assistance to get it rectified immediately. If you reach out to us, just so you know, that's who I'm calling, and I will call them. I actually did that for Jeff and his team last week with that agent. I think we got it resolved. Yes. Do you know, Jeff? Have you heard? And
I believe so. Yeah, I believe so.
And then this is that knowledge base, and you can see what browsers are supported, how to enable. We recommend you use Chrome or Edge for smoother onboarding, and be sure you clear your cookies. Again, that's on there. And I'll send this over to you as well. And I think Jeff and Brad, when you send this out, you'll probably send the PIN and the code. Now, the interesting thing is, for anybody who has their own agency out there, and Jeff and Brad, I'll let you speak to this a little bit. We only allowed one level down. I don't know how you say that exactly, but being that we were new, we didn't allow multiple levels and downstreams. So anybody who applies, you won't, and you go through Cornerstone, you will not be requested to include your W-9 or your banking information, because we will be paying Cornerstone, who will then be paying you. This is the workflow that you go through. This is, if anyone's ever done anything with technology, this is what's called a wireframe. And you'll see here, there's a welcome form that you have to complete. You have a background check that runs in the background, hence the dark blue. There's a form, the agent agreement, the code of conduct that you need to sign off on. Being that you are part of a group, you will swing right over here. There's an FFM training, a general compliance training. Actually, we've removed that because ACA doesn't require it. There's the custom training that you need to complete, the FFM training and validation, which happens because you filled this in and you probably submitted a document, because I'm guessing most of you already taken it. That comes back. This wait for child is a technical term that means that they're waiting for your license verification and your background check to come back. And when that is done, you are sent an email with your appointment. Actually, I think it comes from me. You get an appointment letter from me, and shortly after that, you will receive your
Appointment.
2 emails from us. My apologies, I'm going to stop sharing my screen. See if I can put the camera on again. See if I can figure that out.
Chris, quick question while on that topic. What's so to complete all of those steps, except for the background check, because those could take a few days. What's that time period to complete the fraud, waste, and abuse and go through the antidote training? Is it like an hour, less than an hour? What's the estimate? Can't hear you, by the way. You muted yourself somehow. I don't think I did. No, can't hear you. Maybe stop sharing, and that'll allow you to go to your control panel. Jeff, is that right?
He's unmuted. Yeah, he's
Yeah, he's unmuted on our end, so
Maybe
he's got to be on
turn off
Chris'
the camera. Crazy.
Sorry, gang.
Does he want to dial in?
Oh, hang on. I saw it go to mute and then unmute. So, Chris, I'm seeing.
Maybe you want to dial in on the phone. I wonder what happened.
It says audio pin not entered. Chris, if you can hear me, the audio pin, hang on, send audio pin to enable, which is, I think I can hear you. So it is, the audio pin is #3014#.
Am I in? Can you hear me?
Yeah, you're in again. There you go.
Sorry about that, everybody.
That was
No
weird.
idea what
I've never experienced this yet.
happened.
Go ahead.
So back to where we were talking about
Certification.
commission payment.
Nope,
And
we
the
were
audio.
talking about timeline to complete the certification.
So my understanding, again, it took me about 20 minutes to go through the test. Now I knew the answers, so I didn't have to read them. But I think this whole process is probably 30 minutes. Should be.
Okay.
So it depends, I guess, on your technical abilities. If you're saying focus on it, and then it should take 2 to 3 days max. So you submit your background check. It's early on in the process. You finish the rest of the process. Then within 2 or 3 days, you should get an email that says you're appointed. And then about 2 or 3 days from there, you'll get an email from us, which will give you access to your portal. And then the other part, which I failed to talk about, we are using Health Sherpa. And Health Sherpa will be, you'll get your access for us, for Antidote, which I believe is a PIN that you have to enter just to make sure that you are logged into our Health Sherpa in the sense of for tracking and recording. And that'll be coordinated through Health Sherpa with your account as well. We do have a white label on Health Sherpa as well. And there will be trainings offered. There will be an email coming out later today or hopefully tomorrow morning from Health Sherpa for me to provide to Cornerstone for all external reps if they want to have a update, review, or training if never being on Health Sherpa. That training will be held next week, the 16th and the 18th.
Good. Great.
And forgive me, can you guys hear me? Chris, forgive me if I'm wrong, but I think you have an off exchange channel too for those folks that.
We do. So the broker portal, which will be up and running hopefully by the end of this week, early next, which brokers will get an email and give them entry and access to. There is an enrollment form through the broker portal that they can complete to do off exchange.
Okay.
Great. And I think you were going to talk about the money next. I heard commission floated out there.
Well, obviously the commissions were just a review that are $20 PMPM. So we'll be paying Cornerstone, and then Cornerstone will be paying the brokers. So I think I covered it during the slides where we talked about the onboarding process. Brokers will not be asked for W-9 or ACH information because that'll be provided to Cornerstone.
Yeah, and so just a quick thing on that. So if you're already contracted with Cornerstone and you have a business entity, when we redirect the payment to you and you are a business entity, we're going to deposit that money to your business entity. But you're appointing as an individual with Antidote, and with us, we know that you have a business entity, and we will pay that FEIN number, that federal tax ID number.
Correct. And I believe it's our fault for that process, but ODI requires us to appoint individual agents.
Yeah, and that just made it easy for it to pass through us to be able to pay your entity. So that was the quick solution. And we kind of do it for a few other carriers already. So it shouldn't be too different. So just if you contact Jeff or I to get appointed that you want to move forward with this, just let either of us know that, hey, I also have a business entity, and we will get that set up if you're brand new to us. Okay. Chris, what else? Chris, can you put up the other slide, my favorite grid slide, just so everybody can take a really good look at that. So we've talked about a lot of the things since the slide, but it might be a great review. The one I like, not the one I don't like.
Right. I'm just moving it over.
I know.
And then I'll show my screen. Are you seeing the screen?
Yes, sir.
There it is. And then I'm showing Arizona again. Oops. So we'll show Ohio again. So again, we hope this makes it easy for you. And I think this is a quick explanation of how it runs through the benefits. These are live links, which we're not going to push right now because we learned it doesn't work unless I have to log in and log out again. But they are live for you. And are there any questions out there? I think we tried to go through and answer a lot of the questions we got from other presentations, but are there any other questions still out there today?
I don't see anybody in type. Jeff, do we just want to, if somebody of you see, if you can raise your hand if you have a question, we'll unmute your line just for essence of time so we don't consume too much of your time today to get you back out on the road.
I think the only thing, while we're waiting for that, the other thing I'd like to reference is I'm only over in Lancaster, Pennsylvania, folks. I will be in Ohio actively starting the next 2-3 weeks through the end of the year, and as well as the rest of the Antidote leadership team. Questions, concerns, problems, I'm coming to resolve them personally. Just so you understand, we're not a huge team at this point. We're a small organization, and we want to grow with you. We're extremely appreciative of Cornerstone and its affiliates selecting us to help us roll out in our initial offering. So we plan to extend our customer service, our support, our help to the Cornerstone agents, whatever you need. All you gotta do is ask. If you want me in a meeting, I'll be at a meeting. If you want me to get on the phone with a family, I'll get on the phone with a family.
Yeah. So Chris, give those dates so people can pencil them in case they want to come in person with questions or to meet you in person.
Sure. So I'm going to be in town. I'm scheduled to be in town next week, which I don't know if anyone's going to want to see me next week or not. I'm sorry, I lied. In 2 weeks, the 23rd to the 27th, I will be in Ohio. I shouldn't just say I'll be in town. I don't know where everyone's at, but I will be in Ohio. So 3 to 5 hours, depending on where you are from you. And then the team is looking to be in Ohio. We'll be in Zanesville and Cleveland starting the 14th to the 20th of November. Now that will be the middle of open enrollment, but if there's a situation or something that arises, we might do some meet and greets in the evenings. We're looking at that schedule now, and we'll get those out to folks. But we will be there, and if someone wants us there, let us know because we'll make that happen.
Yep, perfect. I'm not seeing any hands raised or questions being typed in. So I think we could say, Chris, thanks very much for presenting it. We at Cornerstone are really excited that Antidote came to us as a local Ohio distributor of the product. So we're happy about that. And to many, as we did it in person, there was one overarching theme that I heard, and everybody wished that there was another alternative health plan to get access to the Cleveland Clinic. And that was the level of excitement. For various reasons, I'm not going to call out any carrier that we're appointed with also, but they just wanted an alternative to get that access to Cleveland Clinic. And you saw OSU was also down in Columbus, as well as Nationwide Children's. So that's kind of, why we're here. We are the largest general agency in the state of Ohio. So I think they recognize that and they wanted to partner with us. So that is all for now. Not seeing any questions. So I think this is a great time to say, have a great rest of your week and good luck. I think that the floodgates open up officially on Sunday. But I know you guys are already out there working with your clients to get their drug list, your Medicare clients, get some of those initial appointments completed. So that's really awesome. Jeff and I wish you all the best with that.
Yes.
And we are looking forward to November 1 for the ACA open enrollment. So that is it. Thank you everybody for joining. Really appreciated it. This call is recorded, so an email will go out to everybody that if you wanted to listen to it again, you can just do it on demand late at night or whenever it is that you want. So thanks again, everybody, for joining. Greatly appreciate it. Take care and be well.
Thanks. Thank you.